So when we think back to COVID-19, the numbers are just, well, huge. Around 1.2 million deaths globally. It really defined a whole era, didn't it?
It absolutely did, dominated everything for years. But, the sources we've looked at, including the work Dr. Chris Van Tulleken did for his BBC film.
Right, diseasex, hunting the next pandemic.
Exactly. That film and the experts he spoke to, they paint a different picture. They see COVID less as the main event and more like a warning shot.
A warning shot. If that was just a warning, it really makes you wonder what the global health community thinks is coming next.
Well, that brings us right to diseasex.
Yeah, that's our focus today. It's this code name, isn't it, for the next potential pandemic. So our mission here is to unpack this concept using these sources and figure out why experts are worried the next one could make COVID seem, well, almost mild.
And Van Tulleken's film is key here because it shows the groundwork. What's actually being done now to find and hopefully stop a threat that, by its very nature, we don't even know yet.
Okay, let's unpack this. So let's get the basics down. Diseasex. It sounds quite dramatic, almost science fiction, but it's official.
Oh yeah, very official. The World Health Organization, the WHO, they actually coined the term back in 2018.
Okay.
And it's not one specific disease. It's really a placeholder. Think of it as a label for whatever unknown pathogen, could be a virus, bacteria, anything, might trigger the next really serious global pandemic.
So it has to be broad, almost vague.
Exactly, because if you only prepare for the things you already know, you're guaranteed to be caught off guard by something new. That's the whole point.
Now, the sources do mention that COVID, when it first appeared, was technically unknown.
Yeah.
So it started as a disease X, right?
In a sense, yes. It fit the definition initially.
But Dr. Margaret Harris at the WHO, she stresses that COVID isn't the only potential X. And this is where it gets a bit confusing, I think. We know about diseases like Ebola, Marburg. Their fatality rates are terrifyingly high.
Double digits, yeah.
So why the intense focus on this unknown X when we have these known killers already circulating?
Well, that's the crucial difference. It boils down to speed and novelty. With something like Ebola, terrible as it is, we have protocols. We know how to track it, treat it to some extent.
We have some tools.
Right. But the danger with the true X is that it could cause, massive numbers of deaths before anyone even figures out what it is, let alone how to fight it.
Before we can sequence it or develop anything.
Precisely. Dr. Harris puts it bluntly. A completely new pathogen, something our immune systems have never seen. It could cause devastation that genuinely could make the COVID-19 pandemic look mild.
That's a chilling thought.
It is.
Yeah.
The known threats are manageable to a degree. It's the unknown that has the potential for that uncontrollable exponential spread.
And dealing with that unknown threat, that's why this global surveillance system, the one Dr. Van Tulleken investigated, is so critical.
Absolutely.
He was actually in those daily meetings at WHO headquarters in Geneva, wasn't he?
Right.
Watching them gather reports.
Yeah, getting constant updates from Africa, Asia, the Americas, basically listening for any faint signal, any unusual cluster of illness anywhere.
Like taking the world's temperature every single day.
That's a good way to put it. It's the absolute front line, trying to spot maybe just a few people dying unusually quickly from, say, a respiratory illness in some remote village.
Before it gets out.
Before it hits an airport and goes global, that's the race.
And it's interesting, while they're looking for this unknown X, they're obviously still tracking the known threats very closely.
Yeah.
The ones that could potentially become the next X.
Of course.
Dr. Harris listed the ones keeping them awake. Ebola, Marburg, flu strains, all the coronaviruses.
Yeah.
But she still said, most importantly, there's disease X.
Yeah. And if we connect this to the bigger picture, it really shows you how diverse the potential threat is. The next X, well, it might not even be a virus jumping from an animal.
Right.
Our sources point out it could just as easily be a mutated version of something we know pretty well already. Maybe something shifts because of, climate change or something else.
Or something totally new.
Or something totally new, yeah. Something we haven't even conceived of. And crucially, it's not just viruses. The definition has to include bacteria, maybe antibiotic-resistant strains, or even, aggressive fungal infections.
So preparation means thinking across different types of pathogens entirely.
You got it. Viruses, bacteria, fungi, the whole spectrum.
And to really grasp why this daily watch is so vital, we just need to look at the lethality of the things they are already tracking, the known ones. The death rates are just sobering.
You really are, because when people say COVID was a warning shot, these other known diseases, they're like active missiles, just thankfully not hitting globally yet.
Let's take avian flu. Huge concern right now. One source mentions an outbreak in Vietnam, 129 cases, 65 deaths.
That's over a 50% fatality rate. Just think about that.
Or yellow fever, recently tracked in South America, Bolivia, Brazil, Colombia, Ecuador, Peru. Out of 144 cases, 56 people died. Again, really high double-digit mortality, way beyond what we saw with COVID.
And these examples show you exactly what a worst-case pandemic could look like in terms of sheer lethality. If any of those diseases picked up the ability to spread easily between humans, it could instantly become that nightmare scenario Dr. Harris described.
And speaking of nightmares, the sources really zero in on one particular virus family that has experts deeply worried. Henipavirus.
Ah, yes, henipaviruses.
The fatality rate mentioned is just staggering, between 40 and 75%.
I mean, that's effectively a coin toss, or worse for survival if you get infected. It's almost unimaginable on a large scale. The sources give some history there, too.
They do. There was that outbreak in a Malaysian village back in the 90s. The report says the village was essentially destroyed.
Yeah.
It jumped from pigs to the people caring for them, and it was so deadly, so hard to contain, they needed armed troops to enforce a quarantine.
A level of social disruption.
Yeah.
It's hard to fathom.
And the worry isn't just historical. Modern science is making it scarier. They've found elements of this virus in Australian bats now.
That's right. Which raises the fear, the possibility, that it could evolve to become airborne.
And if you combine that kind of death rate, 40 to 75%, with easy airborne spread, well, that's the recipe for the next diseasex right there, isn't it?
It absolutely is.
Yeah.
Which brings us to another critical point. It's not just the pathogens themselves.
It's us, our modern world.
Pretty much. We've inadvertently built the perfect system to help these diseases spread faster and further than ever before. We've kind of overridden nature's own brakes.
What do you mean nature's brakes? How does that usually work?
Well, generally speaking, viruses tend to evolve to become less deadly over time. Think about it. A virus needs its host to survive and spread.
Right, killing the host too quickly isn't a great strategy for the virus.
Exactly. So milder strains that let the host live longer and interact more tend to outcompete the super lethal ones. It's like the virus's evolution towards being less harmful happens at, let's say, walking pace. Nature takes its time.
But we don't walk anymore. We fly.
Precisely. Global air travel means a deadly new strain can hop continents in hours. Its transmission speed can easily outrun that slow natural tendency towards becoming milder.
So we end up spreading the deadliest version everywhere before it even has a chance to evolve into something less dangerous.
That's the risk, yes.
Yeah.
We've basically created a world that selects for speed of transmission above all else. And we keep pushing the boundaries, creating more opportunities for these jumps to happen. Dr. Van Teleken's film really brings this home.
You mean farming practices?
Especially modern, intensive farming, packing millions of animals together, often in close proximity to humans. It's like setting up millions upon millions of little laboratories for viruses to mutate and make that jump from animal to human.
And the one that's front and center right now, making headlines in the surveillance world, is H5N1, bird flu.
Yeah, H5N1 is the big one everyone's watching. It's not theoretical anymore. It's actively moving through livestock populations.
We know it got into cows on that huge ranch in Texas.
Right. And critically, it has infected some farm workers, some vets, people in direct contact.
Right.
Now, thankfully, no mass human outbreaks yet, but there was that scare earlier this year, remember? Millions of gallons of raw milk potentially contaminated.
I do remember that. Huge concern.
It just shows this virus is worryingly adaptable. It's crossing species barriers more readily than we'd like.
And that proximity, that momentum, is what has people like Dr. Van Teleken so alarmed. He said, didn't he, that bird flu is now closer to pandemic potential than it's ever been before.
That quote really sums it up. It captures the current danger perfectly. We're facing this stark choice, this dichotomy with H5N1.
Best case versus worst case.
Exactly, best case. It keeps mutating, but maybe it just becomes another mild human flu or fizzles out. Worst case, it hits that awful sweet spot. Highly lethal and spreads easily person to person.
And the WHO, they can't plan for the best case.
No, they have to prepare for the absolute worst. Hope for the best, prepare for the worst. That's the mantra.
So what does this all mean? When you boil it all down, the main takeaway from Dr. Van Teleken's investigation from the WHO's work, it seems to be this state of constant vigilance.
It is. It's a 247 watch looking for that tiny signal, that anomaly, before it explodes.
Trying to buy us time, essentially.
Weeks, maybe, if we're lucky. That warning is what they hope to provide. It just underscores why preparing for the unknown for diseasex is so vital.
Because the definition is so broad. Viruses, bacteria, fungi.
The preparation has to be just as broad. It affects everything. Medicine, vaccine platforms, sure, but also logistics, supply chains, how we communicate globally, everything.
And it seems to circle back to this core issue, the way we live now, the interface between huge animal populations and dense human societies.
Yes, that's the amplifier. Modern farming density plus high-speed global travel. That combination is what makes the next pandemic potentially so much more dangerous than the last one.
It really leaves you with a final thought, doesn't it? Maybe a bit unsettling.
What's that?
Given how interconnected everything is farming, travel, should we start looking at every local outbreak of animal illness anywhere in the world, not just as a local problem, but almost like the ticking of a potential global countdown clock?
Yeah. That's a powerful way to think about it. A sobering one, definitely. Makes you reconsider how we view risk on a global scale.